I'm very grateful to being asked to talk about primary care in the 21st century. I'm in post as a primary care workforce tutor, and as you all know, there are some major challenges going on, not only in the NHS around workforce, but in particular in primary care, and we see it quite often in the news and in the media, and we've obviously started some initiatives locally around that as part of a wider piece of work through Health Education England. And Beverly's asked me to present some today. I'm lucky enough to be joined by Wendy Cunningham, who's a student nurse who's on placement in primary care, and Willis, who's the practice nurse and her mentor, because we thought it would be really good for you to hear from them, their experiences, because I don't know if many of you are aware that up until last year only 1% of student nurses were placed in primary care. So how are we ever going to encourage student nurses to consider a career in primary care going forward if they don't get that experience? So we have got a big piece of work going on around that. So I'd just like to kick off with the presentation to begin with, and then at the end I'm going to ask my colleagues here to give you a little overview of their thoughts on, having taken part in the initiative and the programme, and obviously there's an opportunity for you to ask questions. So if it's okay with you, I'll start off. Okay, so you all know the issues that are facing us. We all know that there's fewer doctors and nurses going into primary care, the issue of part-time working, in particular practice nurses. Certainly in our locality, over 85% of the nurses work part-time. So that skills gap when those girls are retiring and getting students, as I said, to come into primary care when it's a part-time working is very difficult. There's a lack of skills in the wider community. We're shifting more and more care out into the community, and the skill base has got to follow that. Certainly in our area, there was a lack of a workforce analysis, actually knowing the workforce now and in the future, how many GPs, how many practice nurses, what the skill base was, when they're due to retire. There's a lack of training practices. Having those training practices is essential to get, our future workforce up and running. There's an increasing demand on services, as you know, with that increased workload in general coming our way with a rise in long-term conditions. The bulk of long-term conditions care is done in primary care. The shift of care to an out-of-hospital focus, certainly in our area, that's a big piece of work. But the skill base, as I said, is not always following, and we need to get that skill base out there. A lack of resources. We're all stretched with funds. We hear about the NHS needing a further $8 billion just to maintain the function that it's got. We've got an ageing workforce. I mean, I was a practice nurse, and I started practice nursing back in '92, and I did practice nursing for 14 years. And many of my colleagues who were there when I was practice nursing are still there now. So that skills hemorrhage is going to be massive. The list is endless, and I could go on, but I don't want to depress you any further. I'd rather tell you the things that we are doing to address it. So, just to sort of give you an overview, obviously, to get a stable primary care and a primary care workforce, we need the skills and the competencies framework to support that, which will then give us the goal that we want, which is a skilled and flexible primary care workforce to meet the changing demands of our future NHS. Okay, so some of the pieces of work that we're working on at the moment, we've been lucky enough with the support of Health Education England to roll out the GP workforce analysis tool, which Yorkshire and Humber developed. Now this will give us the information that we so desperately need. This is around, how many GPs, the dates of their retirement, whether it's a trainer, whether they're mentors, in particular the nurses, all of the skill base, all of that, data, that evidence, that information will help us with succession planning in the future, because we can see where the shortfalls are and really for the first time plan a robust succession plan for our primary care workforce. There's a real focus at the moment on increasing training practices. Certainly in our area, we've got practices that take GP trainees, med students, FY2 students, paramedic practitioners, and obviously, as I was saying earlier, nursing students now. Looking at pharmacy trainee students, increasing those training practices is a big piece of work that we're doing at the moment, and we've been really successful in that. I've developed a workforce initiatives opportunities document which details for every single practice the benefits, the commitment from the practice, what funding is available, and what are the requirements. And that's really helping galvanizing interest and also getting practices to work together, having a training practice but having trainees placed in another practice with the support of the training practice. So there's a big piece of work going on there. In September, we're rolling out an integrated health and social care apprenticeship program. We've got students from 3 schools that are going on to a 1-year fully funded program, and they will rotate through the health and social care arena. What we want is people to work locally. Certainly in our area, recruiting down in Dover and places like that has been very difficult. So we're trying to encourage our future workforce to work locally, so we're giving them those opportunities. We're just about to roll out a bank for primary care nurses. Agencies that have nurses don't necessarily have the skills for primary care nurses, so we've approached all of our primary care nurses locally who work part-time and asked them if they'd be interested in being part of the primary care nurse bank, which was a really good uptake, and also healthcare assistants. So that's just about to go out. Our GP training induction program, we've got the CLIP program that works here, which is commissioning and learning in commissioning. That's been quite successful. That's been going for a few years now. And as I said, one of the lovely areas that I'm watching develop is the pre-reg student nurse placements. As I said, with only 1% of student nurses being placed in primary care, their opportunities for experiencing it have been very limited, and we've gone from no practices to 8 practices now that have got student nurses on placement at the moment, and obviously we're working on increasing that, and I know that Wendy and Julie will be able to tell you in a little while about the benefits of that. For our primary care nursing workforce, we've set up a web-based internet resource similar to what Beverly was talking about, the LTC web base, and actually some of my ideas from that came from that, and actually it's a one-stop shop, which I'm hoping that Julie will say she's accessed and has found very useful at some point. We are working on the work experience placements for the local schools within health and social care in the area, and we've also got a clinical buddy and peer mentoring system for nurses now rolling out. Most nurses, as you probably know, work in isolation, as do GPs, so we've got a young GP forum being set up as well to support people so that we maintain the staff that are actually in post, and obviously as part of an induction we give them a robust induction so that we don't have that attrition rate, that fallout rate of people leaving. So that's in terms of sort of the succession planning and actually maintaining the workforce that we've got and actually supporting them. I'll just go on to the next slide. Okay, so obviously as part of that development and making sure that staff have got those skills to meet the demands of the future, we wanted them to have a really robust appraisal process, and in this area we've purchased for the first couple of years the appraisal toolkit for the nurses, which matches the GP toolkit that they use. So we've got a real synergy between the doctors and the nurses in terms of their development. I mentioned the Workforce Initiatives Directory, which the practices have to show them what opportunities are available for them and how it can support them. There's the development of a community education provider network going on. Now, I know that London and the Southeast network have got one that's up and running, and we have been talking with them about how we develop that going forward for our local area. And the community education provider network brings together all of the education teams in social care, in the universities, in primary care. So we've got the GP deanery involved, we've got the community service providers involved, we've got the mental health, which are being encouraged to be part of. So it will be a real community education provider network with an integrated focus on sharing and learning to develop their skill base, because we want to enhance the skill base of the staff that we've got, but also look at ways that we can share resources and share that learning for our primary care workforce for the future. We've looked at domiciliary care training, so using the community assets, the wider community assets of our domiciliary care services, so looking at training initiatives, in particular about recognising an acute deterioration in the clients that they visit in their homes. So carers who are going in on a regular basis will be the first people to recognise a slight deterioration in their charges, basically. So we've put a request for funding in to roll that out locally. We've looked at our clinical skill base for primary care, as I said, and I know that there isn't a national one that's been developed anyway, and that will be in conjunction with the Queen's Nursing Transition to Primary Care document that is due to roll out very shortly. But we wanted to sort of start some sort of local initiative just to get the ball rolling, as I said. We've obviously got a Return to Medicine and Return to Nursing initiative in primary care locally that we are advertising, and we're encouraging nurses to come back into primary care. Initially, most of the Return to Nursing initiatives were placements in the acute trust or in the provider arm, and it hadn't occurred to many to consider primary care. So we're obviously encouraging our staff in primary care to encourage nurses or doctors to come back into general practice. I mentioned to you earlier about the Young GP Forum. Those young GPs that have started, we want to support them through that forum. So we've got one of our young GPs that's doing that at the moment, and they're going to be using some of the technology to support that. We've got a virtual practice nurse forum that's being rolled out to support nurses. Getting practice nurses and nurse practitioners in particular to attend meetings on a regular basis is really difficult, and it's really important for them to get that national information and that local information fed down to them. So we've scoped an interest in a virtual practice nurse forum, and that has been a very positive response. So that's the stance that we're taking. And a preceptorship program for primary care nurses. So looking at primary care as a whole, not just community nurse and primary care nurse, but actually a primary care nurse that can transcend, transcend general practice and the community. And this is just an example of a competency skill base that we started, going from, a Band 3 HCA to a Band 8A. I'm not going to go into great detail with it, but it just gives you a little bit of a flavour of the types of things that we're trying to, or we've been working on developing locally for our staff. So getting our staff working in a much smarter way with more skill base and shared learning, and using the staff that we've got in a much smarter way. This is just an example of the web resource page that look at. So the next steps really for us are integrating the practice, the nurses embedded and all working across community and general practice primary care nurses. As I said, that's something that we're developing locally. But that's something that it will obviously take a little bit of time to embed. And obviously that community education provider network, as I said, we are developing that at the moment, and it's how that will be managed, and it's the funds for the education. If you've got an integrated community education provider network, you've obviously got pots of money coming from Health Education England for primary care, for community care, and then obviously you've got social care. So it's how that money is managed and how that's streamlined into this community education provider network. So those are some of the pieces of work that we're working through at the moment. Obviously, the physician associate role, which I'm sure some of you have heard, we're looking at the development of that, and we've actually got in January with one of the universities first cohort of physician associates, and we've got some areas in South Kent Coast where they're looking to have them on placement to support the GPs, and in particular in the primary care hubs. And I know some of the acute trusts are looking at that, so that's another piece of work that we're looking at. So in summary, and I won't go through this, but essentially what we're looking at is a workforce that is flexible to meet the demands of the future. We've got some real challenges ahead. We've got an increasing and aging population, an increasing amount of patients with long-term conditions. The workforce that we've got, we need to make sure that they can meet the demands of the service in the future. And if we've got an aging workforce, how are we going to backfill that? So we have started now on some pieces of work that will hopefully enable us to meet those challenges going forward. Some of the pieces of work that I've highlighted have started already, and as I said, we're getting some really positive feedback from the nurses on placement, some of the young GPs, the GP trainees. There's lots of strands of work going on that will support the workforce in the future. But for primary care, we can't keep doing what we've always done, because that's why we're facing the challenges that we've got now. So what we're trying to do is to look outside the box and look at what else we could do to support that primary care workforce in the future, and that primary care workforce with the right skills and the right competencies. So I've got to the end of my presentation, and I'm going to just, if you could bear with me, before you ask any questions, just hand over to Wendy, who's our student nurse, and ask her if she could just give us a description of her thoughts on being placed in primary care and what she thought before she came, and what, how she feels about a career in primary care in the future. So I'll hand you over to Wendy.
Hello, yeah, I'm a first-year student nurse. This is my second placement. It's actually 11 weeks worth. When I was first notified of the placement, I did have some initial concerns, mainly because I was concerned that I wouldn't achieve the skills that I need to achieve in the first year. I wasn't sure really the role of the practice nurse, just only by own personal experiences, but you're not really, entirely sure of the level of knowledge and the level of skills. And that is something that surprised me. And I actually met with my tutor about it because of the concerns. But having now been on placement, I am surprised at the level of knowledge and skills of a practice nurse. And for me, the main things is monitoring and managing long-term conditions of patients, particularly respiratory conditions, blood pressure, diabetes, and leg ulcers. So that sort of develops my wound assessment skills and wound dressing skills. And also it's been the links to the practice, the community links, the different professionals that are involved. And I've actually been out and worked with some other people that are attached to the surgery, so it's been really good for sort of developing the collaborative working skills as well. So if anyone's got any specific questions, I'm happy to answer them.
Thanks, Wendy. And I'm just going to ask Julie, who's the nurse mentor for Wendy, also just to give her thoughts on what it's like to have a trainee in practice, and also the benefits to the practice.
Hello, I'm Julie. I've been a practice nurse for 10 years, having students of mental health, and Wendy's my first adult nursing student, but we've been having students for about the last 4 or 5 years. Difficulties in having a student. It is time consuming, it is hard work, but it is very, very rewarding work. Seeing your student grow and their skills and their learning ability grow whilst they're in your practice. You know, they come very nervous, they come sometimes not knowing anything at all, and when they leave, you know, they leave with a newfound knowledge and hopefully, you know, wanting to come back into primary care. And that's, you know, a real big part of it, I think. You know, we have had one mental health nurse student who actually was debating whether or not to go into general nursing because she loved the placement that much, which I think shows a lot. You know, it's not just me alone. The students work with my colleagues in the surgery, so they get a real mixture of all capabilities and working with other people. The other benefit is, I think, for the students themselves, which I think Wendy said to me before, is she's never had a placement and she knows other students. They struggle to find time with their actual placement mentor, whereas she's had 90% of the time with me. You know, we have time to ask questions, we give ourselves time to go through all of her competencies, and we try and enhance those as we go along. And obviously, if there's something that she hasn't found that we can do, we've tried to get her a placement within the wider community so it actually achieves all of her competencies. It is rewarding. It's rewarding for me as well, and it keeps me up to date because I have to be on the ball and know what I'm talking about. And obviously, it's good for them as well for communication skills and seeing patients come back time and time again. That's the one thing that she really wanted to see, is now she wants to see people get better as we've gone through. So I'll hand you back over to Sharon now, but it is really, really rewarding.